Hi, I'm Dr. Mark Emami, your endodontist here at Quincy Center for Endodontics. Now, if you're watching this video, you've probably been told by your dentist that you need a root canal. And you might be thinking, what is a root canal? Or why do I even need a root canal? Well, before we get into that, why don't we go into a brief review of the anatomy of your tooth? Well, very simply, a tooth can be broken down into two sections. You have the clinical crown, which is the part of the tooth that you can see when you open your mouth, and then you have the root surface, which is the part of the tooth that gets embedded in bone. The outer protective layer of the tooth is called the enamel. Underneath the enamel, we have dentin, and inside the dentin, we have the pulp chamber. The pulp chamber is the part of the tooth that houses nerve tissue and very small blood vessels. This nerve tissue and blood vessels enters the tooth through the root, goes and circulates in the pulp chamber, and then exits the tooth through another root. So why do you need a root canal? Well, most people need a root canal when their tooth either has a crack or it has a small cavity. Cavity tends to start in the enamel. If left untreated, it gets bigger and bigger until it gets into the dentin. Once it gets to the dentin, the decay can travel even faster. And that's when we have the decay traveling to the nerve tissue. Once decay gets to the nerve tissue gets inflamed. And that's when you start to have the feeling of cold sensitivity, a pounding toothache, and the kind of pain that keeps you up at night. If left untreated, that decay will eventually kill the nerve tissue until we get to a point where we get periodontitis. That's when the nerve tissue is dead, causing an infection in your jaw. Although it may not hurt once it starts, over time, as that infection gets worse, the pain gradually increases until you start to get a throbbing toothache again. And in this illustration, we can see how cavity starts in the enamel and travels down towards the dentin. Once in the dentin, the cavity spreads even more rapidly, going into the nerve tissue. Over time, the nerve tissue dies, becoming necrotic and causing an infection. This is also known as a dental abscess. So what exactly is happening during a root canal? Well, during a root canal, we drill a small hole into the chewing surface of the tooth, creating something called an access cavity. This gives us access to the nerve tissue. The nerve tissue is then removed and debrided with special instruments. Once the tissue has been removed and the inside of the tooth has been cleaned and disinfected, an inert barrier called gutta percha gets placed inside the roots. This helps prevent further bacteria from traveling down the roots into the jaw. Over that will go a temporary filling. Once the filling is placed, the root canal is done. Your next step would be to follow up with your dentist for a crown. Well, I hope you found this video informative, and I hope it helped assuage your fears of having a root canal done. Now, I know the very words root canal can create a lot of anxiety in patients. So if you have any questions, concerns, or comments, please feel free to give us a call here at 617-472-4606. I'll see you at your appointment.